Hello friends, welcome back to my channel Dental Minibytes, Basics to Mastery about all dentistry related educational videos. So today's topic is about mechanisms of bone formation because bone is a hard tissue which forms the main framework of the body. So the mechanisms of bone formation takes place by two basic modes. One is endochondral ossification and another one is intramembranous ossification. In this video we can go through about endochondral ossification. Endochondral ossification, in this type the bone formation does not take place directly, but rather it can convert the cartilage into bone. That is, it needs a cartilage for the bone formation. For easy understanding, I have separated this into 5 headings. One is mesenchymal condensation, formation of cartilaginous model, primary areole formation, secondary areole formation, and differentiation of osteoblast into osteoid. So the first step is the mesenchymal condensation. The mesenchymal cells, first it gets condensed in the center and differentiates into chondrocytes. So these mesenchymal cells differentiates into chondrocytes, which forms the superficial layer, and it is enclosed in a surface called as perichondrium. Perichondrium is nothing but the outer layer of cartilage. So this perichondrium is rich in blood vessels and osteogenic cells, that is osteoblast, osteoclast, so on. Then the second step is formation of cartilaginous model. Once the mesenchymal condensation takes place and perichondrium is formed, the cells of the cartilage, or at first it will be small and then it is irregularly arranged. But whenever the bone formation starts to begin, depending upon the conditions, the cells becomes enlarged. So once the cartilage forms in the center and the perichondrium contains blood vessels and osteogenic potential, so that surrounds the formation of cartilage. Then the enlargement of cartilage takes place with the intracellular matrix in it. So whenever the enlargement of cartilaginous thing occurs, the intracellular substance undergoes calcification. Calcification, see here, there is calcification of the intracellular matrix, and this calcification takes place by the enzyme, important enzyme, alkaline phosphatase. This alkaline phosphatase enzyme is present in blood vessels, so it surrounds the cartilaginous matrix and it causes calcification of the intracellular matrix. So due to this calcification, the cartilage cells will become empty and it forms a cavity like thing which is undernourished. That is causes, that is called as primary areole. Primary areole formation, which is an empty space because due to the calcification of intracellular matrix. And then the secondary areole formation takes place. Secondary areole is nothing but the primary areole here. The primary areole is there, so it fuses with each other. So it fuses with each other to form a calcified bar. This calcified bar causes an empty space, and this is called as secondary areole formation, or it is otherwise called as medullary spaces. Once the secondary areole formation is done, it is invaded by blood vessels, both blood vessels and osteogenic cells. They both come from the perichondrium, that is the outer layer, perichondrium. And this perichondrium, the osteoblast are formed. That osteoblast will causes secretion of osteoid. The osteoblast is a bone forming cell which secretes osteoid on the remnants of the calcified cartilage matrix. Then the osteoid tissue causes mineralization to form a lamellar bone. First formed bone is the lamellar bone, and above this layer again The osteoblast will lay osteoid. So this process continue upon layer by layer, and there is formation of successional lamina. So thereby forming a bone. So additional layer by layer of bone formation takes place. So thus in this endochondral ossification, the cartilage precursor is necessary for the formation of bone. So the cartilage is converted into bone finally. So this is all about endochondral ossification. You can also see the video for intramembranous ossification. Thank you.